Boris Johnson will hold an emergency COBRA meeting today to finalise the UK's battle plan against coronavirus.
Well, it comes as 13 more patients in the UK, including one in Scotland, have tested positive for the virus, taking the total number of cases to 36. Wimbledon College has just announced that it will close until March the 10th and undergo a deep clean after a member of staff tested positive for coronavirus after travelling to Italy.
But with fears rising, is there any need to be concerned? Well, today we're joined by Professor Paul Hunter, an expert in infectious diseases.
And as the first Brit believed to have contracted and survived the virus, we're also speaking to Connor Reid, who's joining us live from Wuhan. So let's start with you, Connor. Hi.
Morning, Connor.
Hopefully you're feeling OK now.
Yeah, so I've recovered. I had it in late November.
So how did it make you feel? How did you know that you'd got it? And in fact, it was only retrospectively you found that you'd had it.
Yeah, so it comes in 3 stages. First, you have like a common cold, and then it progresses to the flu, and then finally pneumonia. And during the cold stage, it wasn't so bad. It was definitely during the flu and the pneumonia, that's when I thought it's getting quite serious. And that's the point that I went to the hospital.
And so you went to the hospital and they gave you an inhaler, they gave you antibiotics, which you didn't want to take because you don't like taking things like that. Are you pleased? Because it wasn't, as Phil just said, retrospectively you were told that it was coronavirus in January. Are you pleased that you didn't know at the time that it was this?
Well, at the time, to be honest, I didn't even know what coronavirus was at that point. So it doesn't matter at that stage. I was sick, I got over it, and that's the way I look at it.
And, I mean, I remember at the time you were quoted as saying that you had a hot toddy and it made you feel a little bit better. I mean, obviously, a hot toddy is no cure for coronavirus, but it was the fact probably at the tail end of your suffering with it that just made you feel slightly better. Mm.
Yeah, absolutely. A hot toddy definitely works for a bad cough if you have a bad throat, and it definitely eases some of the flu symptoms. But as you said, it 100% is not a cure for coronavirus.
So you said that you didn't know about it, you hadn't heard about it. And some Chinese officials have been accused of covering up, maybe not being fully open and honest as quickly as they possibly could be. Do you feel that in China there is a case of the stable door is wide open and the horse is long gone?
No. So I believe that on a regional level and a local level, definitely there were some hospitals covering it up. But the party as a whole, on a national level, they've learned from their lessons from the SARS outbreak. So that with the information, they're not covering it up, and the numbers that they are releasing are definitely accurate.
And so what's the atmosphere like now? Because you're still there. You're obviously still all on lockdown. What happens if your cupboards are running low and you need food?
Yeah, so we're all under quarantine still. All the shops are closed, and no private citizen can purchase from shops. Everything's done by group buying with your community. So each community has a community manager, and then you contact them and they purchase things for you. It then gets delivered to your gate and you pick it up from there.
So it must be eerie looking out of the window and there can't be anybody moving around.
Yeah, so one person from each household is not allowed to leave for every 3 days. And that person must be registered and have their ID cards with them. It is quite scary because normally the streets are bustling. There's people dancing and singing on the streets. It's normally a very jovial place. But at the moment, it is very dead, and it's very, you can feel the atmosphere that's happening.
So when you look at what's happening here in the UK, as Phil said this morning, it's got the 36th confirmed case of coronavirus here. Do you think we're doing enough? Do you think we should be doing more here?
I believe that there's not much that the government can do and the local governments in general. It's really down to the individual to keep hygienic, to wash their hands, to make sure that they're not touching people, that sort of thing. Just on a personal level, there's a lot that we can do just to help ourselves.
All right, well, Connor, thank you very much indeed.
Look
Stay well. Hopefully you'll be able to get back home very soon.
Yeah.
Thank you for joining us today. We've got Professor Paul Hunter with us now.
Welcome, welcome, welcome.
You said you felt in January there was a reasonable chance that we could control it. How do you feel about that now?
I'm substantially less optimistic than I was 6 weeks ago. I think, although it's not totally inevitable that we will still see global spread, I think it's pretty close to inevitable.
And how bad could it get?
Well, it's interesting. People keep doing all sorts of modelling exercises to try and estimate it, and there is quite a wide range of possible outcomes. At its worst, it might affect about half of the population in the UK and possibly then be responsible for up to 500,000, 1 million deaths within the UK. Personally, I don't think it will actually get anywhere near that, but it will still be substantially worse than a typical flu year, maybe with 100,000 fatalities.
Getting the timing right here is essential, isn't it? Because
absolutely.
When do you lock down cities? When do you shut businesses? Because we've already seen with the global markets, which I think have rattled a little bit today, but you know the devastating effect that it can have economically, globally. So when do you decide, right, that's it, we're locking down your town, we're locking down your city, or when do you say, let's just wait and see?
Well, it depends on what's going on elsewhere in the country, because if you've got cases occurring throughout the country, then locking down any one city is pretty pointless because it's everywhere. If we get to that point, we will not be actually doing containment. The whole point of containment around Wuhan was to stop it spreading from Wuhan to the rest of the world. Arguably now that has failed, and consequently the same sort of rigour of control and isolation of a big city probably isn't going to be worthwhile anymore because it's around everywhere anyway.
So little things then, because Connor was saying you can do things to protect yourself. We know about sort of hand washing. I mean, already you sort of feel there's sort of a shift where people are not wanting to shake hands.
Yes.
I mean, are these things that we really should be implementing for ourselves?
Oh, absolutely. I think one of the important things is how old you are. You know, the World Health Organization has recently just said, the Director General just said that if you're over 60, avoid crowded places, possibly avoid public transport, that sort of thing. Now, we're not at the point where we need to do that in the UK, but it's quite plausible that we will be. And so if you're over 60, you need to be trying to think of ways that you can protect yourself. And in any event, reducing the risk of spread, staying about, you know, at least a metre away from people that you meet in the street, if you can do that. Don't go to crowded places, and especially if you're over 60. And I think shaking hands is one of those things that you should perhaps be trying to avoid. I've started now. Hopefully, I'll get into the habit of it before I actually need to not shake hands.
Well, you see it. I mean, in sporting events, footballers aren't shaking hands. They're sort of, you know, nod at the head or bowing or whatever it is, but they're not shaking hands. So it feels, it feels like there's a change.
Well, a lot of schools have implemented that.
Yeah.
Yes.
And so, apart from the fact that, you know, it's very difficult to stay a metre away from someone if you're coming to work on the underground or a bus,
well,
or,
absolutely.
You know, that sort of thing does make it very difficult. How long is this going to last for?
I don't know. I suspect that what will happen is that it'll continue into the summer. And one of the big issues at the moment is to whether it will then actually disappear or whether it will come back next winter. Personally, I think it won't disappear totally, and I think we will see a resurgence of it come winter, early next year. And hopefully by then, though, we'll have a vaccine, or we'll soon have a vaccine, and we can protect our more vulnerable
Once you've
people.
had it, can you re-get it?
Well, there are some suggestions. There was a report of a case in Japan, but I'm not convinced by that report myself. Typically, these sorts of viruses, once you get them, you tend to be immune, maybe not for life, but for a reasonable period of time, unless you've got some sort of immune problem. You're on high-dose steroids or something like that. I'm not convinced at the moment, but I'm not ruling anything out.
OK, thank you for being here. We won't shake hands.
Well, elbow bump.
Yeah.
Yeah.